Hello everyone, this is Dr. Shastri, Associate Professor, Hepatology, working in Institute of Liver and Biliary Sciences. I am a liver specialist. So today we will learn something about liver cancer, which is medically known as hepatocellular carcinoma. So coming to the prevalence, it is the fifth most common cancer known to world and third most common cancer related death cause. In coming to patients with liver cirrhosis, this is the most common cancer, primary liver cancer or affecting the liver. 90% of the liver cancers are hepatocellular carcinoma. So, and around globally, around more than 5 lakh patients die because of liver cancer annually. And even in India, the incidence of HCC is more than 3.5 to 4 lakhs annually. The occurrence, the death rate is maybe one tenth of it. So coming to risk factors for the development of HCC or liver cancer, it develops most commonly in patients who have cirrhosis of liver. As I said, cirrhosis is the condition in which the liver becomes stiffer than usual because of scarring. Scarring lead to maybe because of many causes like chronic alcohol consumption or long-term alcohol consumption, long-term hepatitis B, hepatitis C infection, or even conditions like long-term fatty liver disease with non-alcoholic steatohepatitis. Any long-term injury will lead to development of cirrhosis, and any cirrhosis will have an increased risk of development of liver cancer. The risk is more so in patients who have hepatitis B or hepatitis C related liver diseases, and even those who have alcoholic liver disease and fatty liver disease related cirrhosis of liver. And the people who have ongoing injury, long-term injury, they are at a higher risk of developing liver cancer. This is one of the end stage events of any liver cirrhosis. Uh, and coming to the presentation, how the patients will come to us, the symptoms are very atypical and very non-specific, and sometimes the patients can come totally asymptomatic, incidentally on ultrasound liver soft tissue lesion is detected, and later on evaluation cirrhosis is detected, and it turns out to be the cancer. Or sometimes patients who are known to have a liver cirrhosis for a long term, they present with new onset liver tumors or liver cancers. So that's why usually in this group of patients who have high risk of developing this liver cancer, we monitor them or screen them on regular basis, usually around as per guidelines 6 monthly, with one simple imaging of ultrasound upper abdomen and a cancer marker alpha fetoprotein, simple blood test, which is done routinely in every patient with cirrhosis at 6 monthly interval. Those who develop the elevation in the levels of the alpha fetoprotein or develop any SOL in the liver, they are screened further with a more definitive test like triple phase CT or a dynamic CT, what we call CT scan, in which the diagnosis is picked up by 100% almost. So usually the tumors are decided on based on number of lesions, location, vascular invasion, portal vein or liver vessels involved or not, and the AFP levels. And the management wise, it depends on at what stage we pick up. So the idea of managing the patient with liver cirrhosis and a HCC depends on the stage at which the patient presents. The most commonly some staging like BCLC or something is used, in which very early disease, less than 2 centimeter lesion, 2 to 5 centimeter, single lesion, multiple lesion, based on which the doctor will decide how we manage the tumor. The best treatment modality that a doctor can offer to a patient with a liver cancer is liver transplantation. Only a very early patients who have liver confined lesion, single lesion less than 5 centimeter, usually are fit for liver transplantation. In a very stable patient without any jaundice, any fluid in the tummy, a single lesion, early liver cancer, when we diagnose on regular screening, pick up very early lesions, they can also be managed with loco-regional treatments, local treatments like burning it out, ablating it, what we call, with a radio frequency ablator or microwave ablation, And sometimes embolization, that means the tumor's blood supply is blocked with the medicine and gel form, deptase, transarterial chemo. The blood vessel which supplies the tumor is blocked, and also given some medicines which will kill the tumor. So that sometimes these treatments, these modalities can give 100% remission or cure, and patients can be cancer free for many years ahead, so that the transplant can be considered at a later stage. This ablation is a modality, is also a curative mode of treatment. And coming to the medical treatment, if the disease is more advanced, not fit for liver transplant, not fit for any loco-regional ablation or embolization, sometimes the vessels are invaded, then we also consider treatment like immunotherapy, which is really expensive currently, but still it has no side effects and works really good in few patients, small proportion of patients. The immune cells of the body are made to act against the tumor, and made to kill the tumor cells, and some people do respond really good to that. There are many drugs like nivolumab or atezolizumab, or many drugs that are available. And in addition to that, the tyrosine kinase inhibitor, some tablets which increase the longevity of the patients, or maybe by 4 months, 6 months, the survival and the quality of life is improved, like tyrosine kinase inhibitors, sorafenib or lenvatinib. Some drugs are available. And in further deteriorated end stage patients, it will just come to palliation, like supportive care, nutrition. So the crux of the management of a liver cancer depends on early detection, high suspicion, and high risk group of population, and targeting them at routine screening, regular time interval screening with a alpha fetoprotein and ultrasound 6 monthly, doing CT once the AFP levels go up, or whenever there is some acute deterioration in condition. And picking up the liver cancer early will help us in curing the patient from the cancer. And the main aim of the treating every cirrhotic patient in follow-up in liver cirrhosis with cancer patients is to treat them early and give them a curative treatment and make their life better. And I hope I could enlighten some points on the liver cancer to public. And I wish to take up any questions, if you can forward it to me so that we can discuss in later sessions. Thank you.